I'm Tracy Caruso. So for those in the media, thank you so much for coming out. I'm working in communications with the Manchester Health Department now. And obviously this is pretty exciting. As you can see, there's pinwheels, which are actually all over the state, I think, Cliff. So someone will explain what they're all about, which is really exciting. I'm not going to be up here introducing everybody. We're going to make this simple because the information they have to share is so much more important than listening to me speak. So I would like to introduce our mayor, Joyce Craig, and she will kick this all off. Please just ask questions at the end. Obviously, I think you all know that, but come right up. Thank you, Tracy.
Well, good morning. As you know, April is National Child Abuse Prevention Month. And as Tracy mentioned, you'll be noticing the blue pinwheels throughout the city, outside of city buildings, schools, and our partner organizations. They're a national symbol for child abuse prevention, serving as a physical reminder of the great childhoods that we want for all of our children. I want to take a minute and thank Anna Thomas, the Director of Public Health, and the Health Department for taking a lead in increasing awareness, and I have a resolution that I'd like to share. The City of Manchester, a resolution. Whereas our children are our most valuable resources and will shape the future of Manchester. And whereas childhood trauma, including abuse and neglect, is a serious problem affecting every segment of our community, and finding solutions requires input and action from everyone. And whereas childhood trauma can have long-term psychological, emotional, and physical effects that have lasting consequences for victims of abuse, and whereas protective factors are conditions that reduce or eliminate risk and promote the social, emotional, and developmental well-being of our children. And whereas effective child abuse prevention activities succeed because of the partnerships created between child welfare professionals, education, health, community, and faith-based organizations, businesses, law enforcement agencies, and families. And whereas communities must take every effort to promote programs and activities that build strong children and families. And whereas we acknowledge that we must work together as a community in partnership to build awareness about child abuse and contribute to promote the social and emotional well-being of children and families in a safe, stable, and nurturing environment. And whereas prevention remains the best defense for our children and our families. Now therefore I, Joyce Craig, Mayor of Manchester, do hereby proclaim April 2023 as Child Abuse Prevention Month in the City of Manchester, and urge all residents to recognize this month by dedicating ourselves to the task of improving the quality of life for our children and our families. I'd now like to introduce Cliff Simmons, Executive Director of the New Hampshire Children's Trust.
Good morning, everyone. My name is Cliff Simmons. I am the Executive Director of New Hampshire Children's Trust. Really happy to be here today. I wanted to thank Mayor Craig and Director Thomas for giving me this opportunity to sort of share some brief remarks with everyone about what we do, who we are, and what the Children's Trust is all about. So our mission is to lead the drive to ensure safe, stable, and nurturing relationships and environments for children. So we do this by educating, by advocating, and collaborating. So we envision a New Hampshire where all children grow up in strong families and healthy communities, free from abuse and neglect. So the Children's Trust is the governor's designated community-based child abuse prevention state lead. We're the New Hampshire chapter of Prevent Child Abuse America. We're a member of both the National Family Support Network and the National Alliance of Children's Trust and Prevention Funds. As a facilitating organization and quality specialist for the network of family resource centers across the state, the Trust provides critical backbone support to these agencies within their communities. But our role really focuses on upstream prevention. So in other words, we're using upstream thinking to identify strategies that build family strength and resilience before challenges occur. So the research is clear. When caregivers have access to concrete supports, parenting strategies, and knowledge of child development, along with social connections, they can do what they do best: create a nurturing environment in which their children thrive. The most important message I can share today is that prevention is possible and that it takes all of us. We get there by creating supportive communities and strong families together. So building healthy communities requires hard work and a commitment from each and every one of us. We all have a role in ensuring children have positive experiences, families have the resources they need when they need them, and that policies and programs put families first, especially during uncertain, stressful times. When we focus on addressing underlying causes that lead to health and social inequities, everyone benefits. So children, parents and caregivers, our institutions, and many of the systems we rely on every day. So we applaud the City of Manchester's efforts to increase awareness of child maltreatment and the community's dedication to foster healthy children and families throughout its work. We are here today to highlight how Manchester's togetherness demonstrates the power of community to keep families strong and children safe. The Children's Trust is honored to support our local family resource centers like Easter Seals and Waypoint, and the many city resources like the Department of Public Health and the fire and safety personnel who prove to us every day that we all are prevention. Thank you.
Good morning, everyone. I'm Nick Georgioulis. I'm a lieutenant with Manchester Police. I'm the lieutenant of the juvenile unit, as well as the domestic and sexual violence unit and the cybercrime unit. As we know, National Child Abuse Prevention Month is a time to raise awareness about the importance of protecting our children from harm and ensuring their safety. The Manchester Police Department works diligently to prevent child abuse and recognizes the need for community partnerships in all that we do. As law enforcement officers, we have a critical role in addressing child abuse. We are often the first to respond to reports of abuse and neglect. From there, the detectives in our juvenile unit, including our school resource officers, work tirelessly to investigate these incidents with the goal of getting justice and support services for the children we serve. We also work collaboratively with our community partners to ensure a successful prosecution. But preventing child abuse requires more than just law enforcement. It requires a collective effort from all of us: parents, teachers, healthcare providers, social workers, community leaders. We must all work together to create safe and nurturing environments for our children to grow and thrive. I'd also like to remind everyone here today that we are a mandatory reporting state. So that means any adult that suspects child abuse shall report it, meaning you don't have to know child abuse is happening, you just need to suspect that child abuse or neglect is happening, and you are mandated to report that to DCYF. So I encourage everyone to do that. Regarding collective efforts, one example that we've worked on for many years now is our Adverse Childhood Experiences Response Team, known as ACERT. This is a team made up of a police officer, a crisis advocate, and a behavioral health professional who have been trained to respond to homes after an incident where a child has been victimized or exposed to trauma or violence. The team assesses each situation and determines the next steps that could be taken for the child, such as support groups, mental health counseling, early childhood education, child-parent psychotherapy, and more. This program has shown measurable success and has continued to grow and adapt over the years and meet the needs of our community. So this month, let us rededicate ourselves to this important cause. Let us work together to raise awareness, support victims, and hold perpetrators accountable. And let us never forget that protecting our children is not just a legal obligation, but a moral imperative. Thank you.
Good morning. I am Jennifer Gillis. I am the superintendent of the Manchester School District. Our district's strategic focus is ensuring all of our students graduate from high school prepared for college, career, or service, while also providing a whole student approach to learning. In this whole child mindset, we must look at making sure our students feel safe and their basic needs are addressed so they are available daily for learning. Our students are our future, and we recognize it takes an entire community to support this team. I'm incredibly honored that Director Thomas pulled our district in to be a part of this event today. Our work starts with our earliest of students, and it goes well beyond the classroom as we work with our school staff and community partners to support our families in building safe, nurturing environments that allow our students to grow and thrive. We recognize that our staff are often the first to recognize signs of abuse and neglect among our students, and we are vigilant in our duty as mandatory reporters to report to the proper authorities. Keeping our students safe, growing, and thriving is all of our responsibility. And seeing everyone here this morning is a great reminder that we are all in this work together for our students. I want to thank everybody this morning for joining us this month as we continue to support our students across the city and the state.
Hi everyone, I'm Anna Thomas. I'm the Public Health Director with the City of Manchester and can't thank you enough for being here. As you've heard, caring for our children as a community is a shared responsibility. We all play a role in that. We know that unfortunately 1 in 4 children are going to experience child maltreatment over their lifetime. 78% of those cases fall under a neglect category. We also have a proportion, 18% are physically abused, 9% are sexually abused. And unfortunately, we also know that many of these cases go underreported. So we are encouraging families to be proactive. As the lieutenant pointed out, this is a state law and something that we are encouraging all residents to be vigilant. In the state of New Hampshire in 2020, there were close to 10,000 cases reported of abuse and neglect. In Manchester alone, we represented 1,700 of those cases. And that is clearly something that is perpetuated by now coming out of the pandemic. We're seeing more and more needs in communities. Of particular note, 57% of those cases involve some form of substance abuse. So we are trying to do the best we can to be proactive, encourage people to be part of the solution. There is a number that people can call DCYF for, which is Central Intake, and they are open 24/7. Someone is always there to take your call, even on holidays. You can report these cases anonymously, and the number is 603-271-6562. And if you want additional resources as far as how do we foster and nurture healthy families, you can always go to the New Hampshire Children's Trust website. There's a ton of information there that we want people to access and learn from. And we cannot thank you all enough. Again, look for the pinwheels in the city because it's our symbolism that this is something that we are dedicated to, not only for the month of April, but all the months in the year. This is something we are going to remain vigilant for, and we're asking the residents to do the same. So thank you for being here, and we'll take any questions that you might have.
Can you all just line up behind the podium too? So if there is a question, it's. Thank you so much.
Maybe to Nick or the mayor, New Hampshire is a mandatory reporting state. Is it time to maybe start arresting people who don't mandatorily report who should have?
Well, we have, and we will, if the situation is appropriate. So yeah, there is a law in the books for that, and that can be charged and has been.
How many times a year do you think people are charged with that?
In Manchester, I don't know exactly. It's not often, luckily. I mean, generally speaking, as a police, we encounter things because we're made aware of them, right? So, but there are times where we find out things that should have been reported that weren't, and like I said, if we were made aware of those and the facts present themselves, we will investigate and charge accordingly.
And if someone is using drugs, if a parent is using drugs with a child in the room, does that fall under abuse and neglect that should be reported? Can you wait?
If you wouldn't mind, you guys can step up to the podium. Thank you.
You want to say that again?
If a parent is using drugs with a child in the home, right, does that rise to the level of neglect and abuse that should be reported?
Yes, that should be reported.
If there's drugs just in the home, it should be reported.
Yes.
I'm asking.
Yes.
Maybe if it isn't so obvious for somebody else who is like, maybe they're being abused, maybe they're not. Are there certain signs that people should look out for before they actually report something?
Sure. I mean, I would first say, again, I would encourage to err on the side of caution and just call. So like I said, you just need suspicion of abuse. And that's not to say, any little thing you're going to call on. Like use your common sense and good judgment. But if you have a feeling that something's not right, we encourage you to call DCYF. Then it can be investigated, and if there's nothing to it, it can be closed. But if there is, then hopefully we can prevent a child from being further abused. So as far as signs to look out for, I mean, if a child's behavior suddenly changes, obviously if you see any sort of physical injuries to him, if there's any disclosure made by the child, that's obviously a cause for concern that should be reported. And a host of other things. I mean, when it just comes down to good judgment and doing what you think is best.
When you hear 10,000 reports around the state and 1,700 in Manchester, is that a number that that you're kind of expecting?
I mean, I've been doing this for a while now, so yeah, it doesn't unfortunately come as a shock to me. I do know there's obviously a very wide range in what we're talking about in those 1,700 or 10,000 cases. But yes, unfortunately, those numbers exist. There's whole lots of children here, and a lot of people are doing the right thing and calling, so we get a lot of those reports. And like I said, some can be determined to be unfounded, and some will move forward the other way. So I don't put too much stock in that number. I think the more that's reported, the better, because then we have the chance to actually look into it and prevent child abuse further.
I mean, you guys kind of already addressed it, but is there like a common denominator when it comes to all these reports of child abuse, like why it's happening?
No, I mean, I couldn't say there's one common denominator from my perspective. It varies on the situation.
And can I just add one point to that? There are a range of categories that fall in the neglect definition. So something like educational neglect, like a child is not getting to school like they should on a regular basis, that should be a call to DCYF for whatever reason, and it will be investigated and explored. But that is a form of neglect. So those categories are pretty vast and flexible, but it's really in the bigger definition of we want to ensure the health and welfare of children. And if they are not getting their basic needs met, and that includes getting to school like they're supposed to, that should be a call to DCYF.
Just add something. When the reports come in a lot of cases it is neglect, and sometimes it's neglect tied to poverty. And it also provides an opportunity when DCYF gets these calls to help the family get to resources. These are the resources that the Children's Trust provides through the Family Resource Centers, where just concrete support to help with a car repair so that child can get to where they need to get to, whether it's a housing thing or a daycare situation where they need some help. Those are some of the upstream preventative measures that can be instituted for families to create a stronger environment for them, so that some of these things are not occurring, or that it gets to the point where it's crisis.
But Cliff, the Montgomery family was part of the system in both Massachusetts and New Hampshire, and we have a 5-year-old child who's likely murdered. The system didn't work, right?
Well, we're talking about, what I was talking about there was the upstream preventative measures that we can provide to families before a crisis occurs. So before they get to DCYF and before they get to those places, there are very basic things that we know that help protect families and make kids stronger, such as those concrete supports, such as parental education and things like that, that when they have access to these resources and services, that families are stronger, and the resulting abuse and neglect decreases.
But you're providing services once they're already in the system too, correct?
We, everything is it's a full circle, right? So we're trying to help families no matter at what point, but what our organization, our mission is about is really the primary prevention of that. So before they reach to that level of DCYF intervention.
So now I'll just add, a program in Manchester that we're doing utilizing ARPA funds is a newborn baby visit. So a mom has a child and we are visiting her in the hospital. So day one, she understands the services that are available to her and to her family. Again, this is upstream and preventative going forward.
Mayor, what do you think? So the person goes into the home and they see evidence of drug use. What should happen then?
Then they should report it, as the police officer mentioned. That's a crime.
Dr. Gillis, would you mind just addressing, I believe it is teachers or folks in the education system that spend so much time with the children. Are they the highest for reporting suspicion of child abuse?
So I would say in our schools, it's all of our staff. Anybody witnesses or has a suspicion of child abuse or neglect, they're mandatory reporters, so they're to follow that process. I would hesitate just a minute to give you statistics on how they break out in the overall numbers of the state. But I'll say this, we do annual training, we do reboot training to make sure our staff know the process, understand the phone numbers, where to find those numbers, and how to navigate that reporting system. What do they need to have ready to be able to disclose? And I also want to note that in the city, it's not just the schools. We have a pretty remarkable set of community resources and supports. I think it's pretty amazing that we can stand here with community partners today talking about the systems that we roll in. And we train on that within our schools. So who do you go to if you're starting to suspect a student is hitting concerns with poverty or homelessness or food insecurity or being able to get back and forth to the schools? We look at truancy holistically now. We're not looking at just one child. We're looking at the family structure and how do we support them. So I think in Manchester we're incredibly strong and fortunate to have the community partners that we do and the cross communication daily.
And I hate to go back a few years, but when the pandemic was happening and schools shut down, the kids were at home or in locations that maybe no one can actually see behind those closed doors. Did you see an increase in reporting when the public schools opened back up, or could you talk about that a little bit?
Yeah, absolutely. The cases actually were on the rise before the pandemic and they quelled, just like a lot of other health outcome measures like opioid overdoses, for example, quelled during that spell. And then once we started coming out of the pandemic, we're now seeing people much more connected to the community and each other, and we're finding those reports are now back on the rise. So we are trying to ask people to, be vigilant and to continue to feel that they have a role in this, that we all are part of the solution. And we're not just relying on a first responder or a teacher, or you could be a neighbor, you could be someone connected to the family. And I think that's where we're going to try to get to people earlier. And if they need help, they can call 211 for basic services. But even beyond that, any one of our organizations has a plethora of services that we can at least connect families to. So we encourage people to be proactive and seek those out and not wait until we're now waiting for someone to become a number in these unfortunate cases.
What about you, Anna? Would you like to see more arrests of people who should report but didn't?
Listen, I would like to see everyone take responsibility for being part of a community. And that means taking responsibility for your children, taking responsibility for what you contribute to society. We are doing everything we can to try to lift people up, because to me, the greatest measure of success is when we all give back to the greater good. So I'm looking for that in people, and if we're not seeing them being able to think outwardly about how they give back to the greater good, we actually provide them resources to do that. We help them think about something bigger than themselves, and that is the best form of resilience. And if we all can maintain that level of resilience, these kinds of unfortunate situations hopefully are either completely averted or significantly reduced.
Any other questions? Obviously, we can talk to them after as well. If you don't mind, if we could scoot you over this way, I think we'd like to get a group shot with all of you. That would be extremely helpful. Thank you so much.